I recently ran across an article in Self magazine that I thought was great called 5 Signs Your Dry Eye Treatment Isn't Working for You. Because dry eye is what we do here on this channel, I thought it would be fun to go through the article and give you my take on each of their thoughts as an optometrist and dry eye specialist. Welcome back to iSchool with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty so that you can have healthy, beautiful, comfortable eyes. Give a little love tap on that subscribe button to stay up to date with all the latest eye tips and tricks I have for you. I love the idea behind this article because dry eye treatment can truly be so complex with so many options that it's very easy to become overwhelmed, unsure which step to take, and it's important to get a good sense of what has worked for you and what isn't working so that you and your doctor can tailor your treatment to your eyes. Now, before we get started, go to drmelaniedenton.com and download my free guides to help you with tracking your dry eye treatments, because that's exactly what I created these for, to give you a simplified place to put all of your dry eye treatments so that you and your specialist can come up with a plan tailored to you. So let's get to what the article actually said. The first sign that your dry eye treatment might not be working for you is if you've been using your treatment consistently and still aren't seeing improvement. I love this point because it speaks to the fact that many of our dry eye therapies really do take consistency and time to work well. In the case of artificial tears and warm compresses and other at-home hygiene habits, it can take days to weeks for those treatments to work. However, there are multiple prescription options that take months to work, 1 or 2 months to even feel any difference whatsoever. So therefore, it's really important to not get discouraged if your treatment doesn't work immediately, but to also pay attention if it's not working over the course of weeks or months. So let's say, as they do in point number 2 of this article, if your symptoms are getting worse. It is possible, of course, to have an allergic reaction to any of our dry eye treatments. If you're allergic or have a hypersensitivity to any of the ingredients in the treatment, you may notice that your symptoms worsen instead of improving. They're usually going to do so symmetrically in both eyes. Even dry eye treatments sometimes contain preservatives and chemicals that can cause an allergic reaction. I have a little mnemonic I like to use called RSVP. It's very simple to remember because of the common usage of RSVP. But in eye care, RSVP stands for redness, sensitivity to light, vision changes, and pain. Those 4 things should only be getting better with treatment, not worse. And so, if you do have a worsening of R, S, V, or P, make sure to let your doctor know as soon as possible. The next way to know that your dry eye treatment is not working for you is if your treatment is causing side effects that are unpleasant. Some side effects are common in the treatment of dry eyes. For instance, it's incredibly common to have some stinging or burning early on in your treatment, especially with restasis or cequa. This is because the cornea is so dry and abraded that any drops at all will potentially sting. This will often get better as your cornea heals, but if it isn't getting better or feels debilitating to you, you should definitely mention it to your doctor. One thing that wasn't mentioned in this article but is really common is a terrible taste in the back of your throat with medications. This is common and occurs because tears naturally drain into the back of your throat. And if this is a concern for you, you can do what is called punctal occlusion to reduce the amount of drop that drains. Punctal occlusion is simply placing your fingers right here where your punctas are after instilling your eye drops to keep extra drop from draining into the back of your throat. However, if the bad taste in your mouth symptom is a deal breaker, make sure to tell your doctor that so they can find a different dry eye medication for you. So another one is, let's say your treatment is only working in certain climates or on certain days. As a dry eye specialist, I spend a good bit of time during my patient visits understanding my patients' day-to-day habits and environments. And that's because different temperatures, humidity level, and activities absolutely affect how your eyes feel. A great example is my patients that work at the computer 12 hours a day and then retire, and all of a sudden their eyes are feeling much better. If you find that the seasons have changed or you've gone from working at home back to the office and your eyes just don't feel great anymore, definitely discuss that with your doctor. And then the side effects. So if you're finding that the side effects of your dry eye treatment are lasting for a long time after using the treatment, many of our dry eye therapies do come with some side effects that we expect. However, if those symptoms aren't going away, it might be time to let your doctor know. One good example is ointment. It's commonly used at night and it's expected to blur your vision. But if it makes your eyes blurry into the morning, making it difficult for you to get your day started, it might be a good idea to look at other options. Ultimately, your dry eye treatment needs to work for you. It's important that it makes a positive impact on your quality of life and your day-to-day activities. Make sure to check out the original article in Self magazine. I loved it, and I think they take a great approach to walking you through what you should and should not expect with your dry eye treatment. And of course, if you feel that your dry eye treatment is not working well for you, make sure to take notes and take those to your doctor so that a better treatment plan can be implemented. And if you've made it this far and you're not already subscribed to this channel, please do that now and make sure to hit the button, the bell, so that you don't miss notifications. That is going to be it for today's iSchool. Class is dismissed.